I think mental health and the arts have got an entwined history, and psychiatric genetics isn't overt, isn't visible in the way that some other scientific practices are. And what I mean by that, if you want to kind of get across physics, you might show an experiment, and you can see that visually happening. Whereas psychiatric genetics, perhaps instrumentationally it is visible, but a lot of the work is done in laboratories, and a lot of the work is sort of hidden away. So working with the artists, I think, gives it that type of visibility as well. Now, as a lab worker, as a psychiatrist, it might be a new challenge or something completely different in working with artists, and of course it's not for everybody. But I think a number of them have got quite interested in working with the art because they're getting a different perspective. I think art has always engaged with publics very well. That's why you have public galleries. That's why there's an invitation there for people to come and interact with that piece of work. But it's also allowed them to look at the artwork and then as such take a different perspective on the work that they're doing. I think Julia's work in particular, but also Reese's as well, so contextualizes psychiatry, psychiatric genetics within a sort of different frame to what the researchers here see, which is their work as such. Now they're putting it into a sort of social domain or a cultural domain, and how others might interact with it. So I think a lot of certainly the early career researchers have got a lot out of working with the artists, or at least engaging with the art itself. I think it allows them to widen their area of expertise. Science is very disciplined, it's very specialised, and in lots of ways people, certainly through their training, are very much encouraged to focus in a particular area, which is great and important. At the same time, I think having a wider idea of people's attitudes towards something, or being able to contextualise your particular area within a wider domain is important too, and something perhaps bioscientists aren't trained to do as much, certainly when you compare it to perhaps the social sciences or the humanities. So I think enabling that interaction with how their work sort of fits within a more global system, I think, is important. And I think the arts does that very well. I mean, obviously certain artworks are very fine, very, very detailed, but I think they're often a social commentary on the world as it is at that moment in time. And I think that's what a lot of the researchers are taken away from working with the art, in particular, obviously, in relation to mental health, public attitudes to mental health, clinical aspects of mental health, and not just the laboratory work that they might focus their work on.